Hello, very good evening to all of you. I'm Sayukta from Prostatewellbeing team, and we hope you and your loved ones are staying healthy and taking steps towards better well-being. Today's session is especially important as we are going to discuss a health issue that affects lakhs of people every year: kidney stones and how radiology plays a crucial role in its diagnosis and management. Kidney stones can cause severe pain, urinary complexion, and if ignored, may lead to kidney damage. But the good news is, with early detection through radiological tools, timely diagnosis, and proper treatment, they can be effectively managed and prevented. So, to guide us on this critical topic, we are honored to have with us Dr. Anil Keskar, a highly respected consultant urologist and endocrinologist. Dr. Anil Keskar holds MBBS, MS, and MCH in urology and currently serves as the director at Vighnaharta Super Specialty Hospital located in Keshav Nagar, Mundhawa, Pune. Dr. Keskar is known for combining surgical excellence with compassionate care and has helped numerous patients recover from complex kidney and urinary tract conditions with confidence. His experience, coupled with a deep understanding of radiological interventions, ensure that patients receive accurate diagnosis and advanced care. A very warm welcome to you, Dr. Keskar. बहुत बहुत स्वागत है आपका आज के हमारे सेशन.
Thank you. Thank you for having me.
So, doctor, what exactly are kidney stones and how do they form?
Kidney stones are the hard minerals and salts that are deposited in the kidney. Basically, calcium, oxalate, and uric acid, they get stick together and they form the crystals and that deposits in the kidney. That we called as a kidney stone. So,
Okay.
yeah. There are various causes of this kidney stone formation. One of the most common reason for the formation of kidney stone is dehydration. Whenever we take less intake of water, usually we should take at least 3 liters of water per day. So if we take less amount of water, then that will results in concentrated formation of urine. So that calcium minerals that oxalates will deposit that will form in the kidney that in concentrated form. So they will stick together and they crystallize and form the stone. So dehydration is one of the most important cause for kidney stone formation. Other causes are like certain diets. Sometimes we eat oxalate rich diet food. So spinach and nuts. We take a lot of. If we take it, then that will result in oxalate stone formation. Also, some people eat non-vegetarian diet, so uric acid stone formation will be high in that case. And certain diseases like medical conditions like hyperparathyroidism, gout, and kidney disorder that will form the kidney stone.
Okay, doctor. Doctor, what are the common signs and symptoms that may suggest that someone has a kidney stone?
Yes, the most important symptom is lumbar pain. A patient will complain you the severe pain in the flank region, abdominal pain we can say. That pain is in the back region. Sometimes it may in the usually it radiates in the groin region. So that pain will be very severe pain, and patient has to be uh, means he has to go to hospital only for that treatment. So this is very severe pain. Other symptoms like blood in the urine, or it may increase frequency of micturition or dysuria, like burning micturition, and vomiting. Also, sometimes patient may feel. So these are the common symptoms when patient will have kidney stone.
Okay, doctor. Now, doctor, what role does radiology play in the diagnosis of kidney stains and which are the scans that are most effective?
The gold standard for the diagnosis of kidney stone is a non-contrast CT scan. Non-contrast CT scan is very precise and accurate for detection of kidney stone. It helps to detect size of the kidney stone and the location of the kidney stone also. But before that, we usually once patient came in our hospital, First, we do ultrasonography abdomen pelvis of the patient. This is the screening test, so that will help us to detect stone. But sometimes chances of missing the stone in the ureter is high in ultrasonography abdomen pelvis. For that precise and accurate, we find the stone. Then CT scan, non-contrast CT scan is the best option that helps to detect the stone. So these are the radiological tests that we prescribe first in when patient comes to our OPD. Yeah.
Doctor, these scans, the imaging, do they help determine the size, type, or location of a kidney stone and guide the treatment decisions?
Yes, absolutely. Size of the stone and location of the stone, that will help us to determine which approach we have to proceed further. Some patient will have a very small stone, like less than 6 mm. In that patient, we usually do a medical treatment, medical expulsion therapy, we call it as. Some patient, if the stone is more than 6 mm or 10 mm, in that patient, we usually do surgical intervention. So radiological assessment is very important. Precise size of the stone, precise location, and the accurate size of the stone is very important for determination of which medical therapy or surgical intervention is required to patient for that.
Right. Now, doctor, what treatment options are available today? And as you said, radiology now plays a very important role. Then, how has radiology made procedures more precise and less invasive?
Because patient, if the stone is in the kidney or in the upper ureter, we usually do RIRS. RIRS is a very advanced procedure. In that procedure, what we do is, if the means patient has a stone in the kidney, we do surgery in inserting the scope through the urethra only. This RIRS procedure is not means there is no there is no cut over the body. That means it is a scarless procedure. It is a
Right.
bloodless procedure, and it is a daycare procedure. So it's a very patient will have very rapid recovery. So it's very comfortable for the patient. And so RIRS surgery is a advanced procedure, and that we do what we do is we insert the scope through the urethra, and once we reach the stone, we activate the laser there. So once we activate the laser, the stone will break down into the powder, and that powder will come out through the urethra only. So there is no scar over the body. That is the beauty of surgery. So another options are there also. But if the stone is less than 20 mm and in the upper ureter and kidney, so this advanced laser procedure we do it for that stone. If the stone is more than 20 mm in the kidney, then we have to go for PCNL. PCNL is very minimal invasive surgery where small cut over the flank region, where 1 centimeter, less than 1 centimeter, we do it, and through that cut, we made a tract over the kidney, and that tract we go inside the kidney, and we remove the stone by activating the laser over there. So this is the mini PCNL. This is also minimal invasive surgery, and
Right.
other surgeries like if the stone is in the bladder, we do it remove the stone via fistula lithotripsy. All the procedure in the urology are very minimal invasive surgery where they are daycare surgeries. We discharge the patient after 24 hours. So it's a very advanced surgeries comes out for the this kidney stones.
Absolutely. So surgeries are less invasive these days, bloodless, scarless mostly. And if the patient takes the right advice from the good qualified, board certified urologist, of course, you'll have a good, healthy life ahead. Now, doctor, we have heard a lot about recurrence of kidney stones, So how can patients prevent recurrence of kidney stones through lifestyle or diet modifications?
Yes, yes. We have to prevent the formation of kidney stone. For prevention, hydration is the key. Hydration is the key. where the aim has that means patient has to take at least 3 liters of water in a day. So that will help to decrease the concentration in the kidney, what we previously discussed, where more and more concentration of that minerals and salt, if we have in the kidney, that will form the crystals. But if we take more and more water, then that crystallization will be inhibited because of less concentration of that salts in the kidney. So hydration is the key. At least 3 liter water should have. Um, and dietary modifications, non-vegetarian diet should be minimized. Less salt, less sodium should be intake. There should be less sodium intake, and oxalate-rich foods like nuts we should be minimized. So other dietary modification like decrease coffee intake and tomato, palak, that should be avoided.
Fair enough. Doctor, are there any misconceptions or common mistakes patients make when self treating or ignoring kidney stone symptoms? And with that, I would like to add a question by a viewer. Can kidney stones go away on their own? This is another, I guess, is it
Yes,
also
yes,
a
yes,
kind
yes.
of misconception?
Yes, 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 yes. Some people assume that it is just a back pain, or it's a pain is because of just because of indigestion. But sometimes they rely on their home remedies for that. They drink excessive water and think that stone will pass it on, but that is not true. Precise diagnosis, proper diagnosis is very important for treatment of this kidney stone. Some complications like infection of the stone, if we ignore the stone, then that will form the infection, and sometimes we say pyonephrosis, pus formation will be there in the kidney. So whenever there is a pain, we should consult a urologist or doctor, and proper diagnosis through radiological means we have to do it. And other misconceptions are there for kidney stone. If the pain related, sometimes when there is a pain, patient feel that there is a big stone, but it is not like that. Some small stone, even 3 mm, 4 mm stone also can cause the pain if the stone is in the ureter. So we should never ignore that pain. And sometimes in the kidney, if the patient has having a, uh, this stone in the kidney, sometimes it may not cause any pain. So other misconceptions are there. If we take excessive drink of alcohol or beer, sometimes some patient feel that that will pass it as its own, but it is not like that. We should take urological consultation for that, and proper diagnosis and treatment should be taken from urologist only.
Absolutely. So please don't self medicate. Please don't go for home remedies, DIYs, or what the influencers on various social media platforms are asking you to do. Go to the right person, which is a qualified urologist, and take the right
Yes,
advice. There are
yes.
so many questions, but we have already discussed most of them. But very common question again, a viewer of us is asking, Usha Patel, can drinking water help pass a kidney stone faster?
What one?
Can drinking water, lots of water, help pass a kidney stone faster?
Not faster, but it helps a lot. For time, we cannot predict the time, but excess intake of water. Sometimes, if the stone is in the ureter, if it is a small, less than 6 mm, that can easily pass. But we don't predict the time. It will go, but we don't predict the time when the it will go. But what we do is usually we give 5 days therapy, medical special therapy for that. During that period, we give because if we wait more and more time, that will be harmful to the patient. Sometimes more than 5 days, if we wait, that will form the infection there, and that will be that is a complication for surgery. That is a complication of kidney stone.
So after 5 or 7 days, if we are trying to let it pass, we need to do a scan again to see whether it's there or not, what's
Yes,
the
yes, yes.
position, etc.
Yes, sir. Yes, yes. We have to confirm the stone whether it is fast or not after 5 to 7 days. Even pain is not there, still we have to do the scan for that.
Finally, doctor, what message would you like to share with our viewers about kidney stone awareness and the importance of early detection?
Uh, Masses is very clear in this one. Kidney stones are very common than what people realize. Means what people think. They are very common, and but they are preventable. First message I want to give is kidney stones are very common and they are preventable. Second message I want to give here is early detection can prevent complication and reduce the need of more invasive surgery. So radiological feature like a radiological approach we have to get through, and early detection should be done. So whenever you have pain or any symptoms of the disease, you should see the doctor. Yeah.
Absolutely. Thank you so very much, Dr. Anil Keskar, for your clear, insightful, and extremely valuable guidance on this topic. We are confident that today's session has helped our audience better understand how radiology and expert care go hand in hand to manage and prevent kidney stones. Thank you.
Okay. Thank you, ma'am. Thank you for having. Yes.
It was a pleasure, Doctor. And viewers, thank you for your excellent participation. For more such awareness sessions, stay tuned to our Facebook page, Prostate Wellbeing, and follow us on YouTube, Twitter, and Instagram for regular health updates. Thank you for joining us. Stay healthy, stay aware, and take charge of your well being. Have a great evening ahead. Goodbye.
Thank you. Thank you, ma'am. Thank you.